Hi, so today I'm going to be showing you how to do a lower back massage on somebody who's seated and clothed. This is for people who have a lot of lower back pain, either from sitting at a desk or from having tight hips, bad posture, other medical issues. This is great for people who are getting ready for hip surgery or recovering from hip surgery. You want to have them be at a desk or at a bench with a chair that doesn't have wheels on it so that it's very sturdy. And in this demonstration, I am going to be using a lot of pressure. You always want to check in with your client and make sure that that's okay. Don't go deeper than they're comfortable with, and always make sure that they're going to let you know how they're feeling. So on that note, enjoy. It's always important to do warm up the tissue and do a little effleurage at first. Of course, you want to have your client, recipient of the massage, be seated at a place where their back is exposed, but they have something to lean on. So a desk chair turned around facing the desk, or a dining room table, or a bench like this if you have the chance to go outside. So what I'm doing now is I'm just sort of warming up for back muscles and getting some blood flow, also getting a sense of what's tight. Following the spine using the palm of my hands. I want to have my body weight behind the palm, so I'm not just using my hand or my wrist or my arm. That might hurt me and won't be sustainable in the long run. So if I use some of my body weight and do a little bit more pressure, of course going gradually deeper, not right away, and just along the spine, all of those muscles that are through there that are keeping us up all day, every day. And I'm going to be doing this pretty equal on both sides. Obviously, everybody's body is different. So if you have somebody who has a lot more tension on one side, you would modify this and spend more time and do deeper pressure on that side. Always checking in with the client to make sure that the pressure is good. You will have asked them at the beginning if they have any injuries and what their areas of concern are. So now that we've warmed it up a little bit along the spine, we're going to warm up the hips, because all of the tension, well, a lot of the tension in your lower back is related to tension in your hips. They will be anchoring the rest of your body weight. So what I'm doing here is I have a fist and doing a circular motion, rhythmic, alternating back and forth along those big muscles around your hip joint, the glute muscles, all of those little attachment sites for hamstrings. This is good for anybody who has pain around their SI joint, their sacroiliac joint, where their spine and their pelvis come together. Most of us have some tension there. People that have lower back pain usually have a lot of tension there. These muscles all attach in around those areas, so you want to kind of bring blood flow, loosen it up. And the rhythm is also helpful for relaxing. Most people, you will have the occasional client where rocking, any kind of rhythmic motion is actually going to make them uncomfortable, maybe nauseous. So again, checking in with them. If they don't want anything rhythmic and this technique for loosening up the hips isn't going to work for them, then you're just going to do the same thing that I was doing along the spine. Have your body weight behind you, using the palm of your hand and doing a more gentle, more gradual circular motion, putting pressure behind your arm, putting pressure behind your hands, but being careful to keep your wrist as straight as possible so that you're not injuring that. And once you feel like that tissue is warmed up, it's probably good to do that deep pressure on the SI joint. All depending on what you felt on your client, how tense it is there, how much of a little knot they might have. Now I'm in a squat position right now, which is pretty comfortable for me. Not everybody's gonna wanna do this. Some people are gonna wanna be in more of a horse stance, like this, so that you're getting more power from your legs. And then for some of you, it might make sense to have a little chair or a little stool that you actually sit on while you do this, so that you're not having to engage your lower body at all. All depends on your ability and your comfort zone. So I've got my fingers right on this little knot that's right where her spine and pelvis meet up. And you feel around for it. Almost everybody's got a little knot muscle right there. And that's where you can start to get in deep gradually. You may or may not feel a release. You can go around to the tension around it. See if you can get a little bit of a release there. And then go back to that spot. And then of course switching to the other side. Doing a similar thing depending on what you're feeling in their body and what you're hearing from them about what they want. These are very big muscles. Obviously this is like our core, our foundation, or at least the posterior of our core. So you can get in there pretty deep. And you want to get in there pretty deep for people that have lower back pain. The SI joint is also a really big spot for anybody who has sciatica. The sciatic nerve goes through this joint, and if there's a lot of tension in the muscles around here, it will pinch, and then you get that shooting pain down the back of your leg. It's a big issue for people who are sitting a lot and for pregnant women. Okay, so the other technique that you can use for the hips and this sort of seated clothed massage is kind of a myofascial, for the fascia around the hip joint. What I'm doing is I'm squeezing. So I'm grabbing the muscle, in this case, your muscle in the IT band on the side of her leg where it connects to the hip. I'm squeezing it and then I'm pulling it. Kind of doing a counter motion to what is happening most of the day, which is more pressure going in. And I'm allowing for some blood flow. I'm allowing for some more circulation. And pulling some of those muscle fibers apart that may have gotten bunched up. You may have people come up and ask you for a back massage while you're giving a back massage. You probably don't want to do this in too public of an area because it tends to be something that people want. So now I'm doing that same fascia release on this hip with the pulling, squeezing and pulling, squeezing and pulling. And then, again, being very careful of your hands and your wrists, you can put your thumbs on either SI joint and do pressure back and forth, straightening your wrists and leaning in with your whole body. Keeping your spine straight and your shoulders engaged. You can put a lot of pressure through there. And then this is the nice thing. You can just sort of work your way up gradually. Really putting pressure into those muscles and following the spine. So this is where you want to really spend a lot of time. You've warmed up all the tissue. You've kind of researched the body and figured out where the tension is and what needs work, what kind of pressure your client can take. And then you're going to kind of push that boundary a little bit and go a little bit deeper, putting pressure on the areas that have the most tension, the most knots, and hopefully feeling that loosen up and release. A little bit more motion through here. And then this is a short version. Normally I would actually spend a lot more time on her lower back, but I will speed that part up for you guys.